My name is Dr. Mutabazi, Yesse. I'm the medical director, Doctors Case Medicals, Ishaka. This is Ishaka branch. We have another branch in Rokonjiri, still under the same management. Basically today I'm going to educate us about stroke. We realize that the number of stroke cases have increased, and this may vary depending on what things are giving us the stroke, and majority of the people in our communities do not know how to identify a stroke patient, and some of them have challenges in how these stroke patients could be managed. So basically today we are going to talk about stroke. So for the lay person listening out there and watching, when we mean stroke, we mean that part of your brain is not getting enough blood supply. And by the fact that part of your brain is not getting enough blood supply, that part of the brain will not function very well. So we realize that there are a lot of increasing cases of stroke, especially depending on the risk factors, ranging from various risk factors, as we have said. So we want to educate the community. How does a stroke patient present? How could you prevent a stroke? And lastly, we want to educate us, how could we manage that stroke patient, okay? So as Doctors Case Medicals, we have been receiving various cases of stroke, and as we interact with the majority of these patients, we usually find out the risk factors predisposing these patients to the stroke. So as I was explaining, stroke basically means that part of your brain is not getting enough blood supply. And by the fact that your brain is not getting enough blood supply, that part of the brain cannot function very well. Okay? If it can't function very well, you may start getting some of the symptoms. And people in the communities cannot identify that this is a symptom or a sign of a stroke, and you may end up running to a local herbalist, or you may run to church. Yet if you ran very fast to a health facility and we identify that this is stroke, it would benefit your patient, especially here at Doctors Case Medicals. So when we are talking about stroke, there are two major kinds of stroke which we encounter in the medical facility. And one of them is, there is what we call a hemorrhagic stroke. For the dear listeners and the viewers, when we are talking about the hemorrhagic stroke, we mean that part of the blood vessels supplying your brain, they have been damaged, they burst, and then there is a leakage of blood. By the fact that there is a leakage of blood, part of that brain will not get what? Blood supply. So that can give you a stroke. Then the other kind of stroke usually we encounter is what we call the ischemic stroke. The one listening, ischemic stroke shouldn't beat your mind. It basically means that there is that part of the brain, the blood vessels which are supplying that part of the brain have gotten a clot, a blood clot, and that blood clot has cut off blood supply. And that means that part of the brain will not function well. Yes, so those are the two kinds of stroke we encounter, especially at Doctors Case Medicals. So the listener and the viewer out there, you should be able to know, if you have a patient at home, how does this patient present, for you to clearly identify and know that depending on this and this, probably my relative, my husband, my sister could be having a stroke. So the first kind of signs, it depends, by the way, on the part of the brain that has been affected. For example, did you know that a stroke patient could present with poor eyesight? You can have a stroke and the early symptoms are failure to see clearly. Then you could have other symptoms like failure to speak. You could have a problem in part of the brain that usually controls your speech. So you might have issues with speaking, either with a coherent speech. Usually when we are speaking, your speech should make sense. So you might either fail to speak, or you could have with a problem with speech that makes sense. Then we could have headaches. Headaches sometimes are also some of the first signs of a stroke that is happening, especially the headaches of a hemorrhagic stroke. As I've told you, part of the blood vessel breaks up, bursts, and there is blood leaking into the brain tissues. So headache can be one of the good signs that could clearly tell you that there is a stroke. Then other signs and symptoms, we could have what we call seizures. Seizures in the local language, people call them ebihungu, ebiyaga, but usually we are basically meaning that your brain is having a lot of electric activity. It cannot be controlled, and it sets your body into rhythms of contractions and relaxations. So usually you see seizures or convulsions in children who have a high fever, but you could have a stroke patient having what we call seizures. Then other signs and symptoms, usually at doctor's case, we see majority of the patients come with numbness or weakness. A patient can come with weakness either in the upper limbs. The hand is very weak. If you tell them to raise their hands, you find out that one hand is lagging. Okay, it is really weak. The muscles are weak. Or even that part of the body, the same side where the hand is weak, it is also having weakness. So for us in the medical field, we call it hemiparesis. That part of your body half is weak. And for us, usually we know that this part of the brain controls this side of the body, and this part of the brain controls this side of the body. So when you encounter a skilled doctor, health professional, like at doctor's case we have, immediately we look at this patient. This is left side body weakness. We know probably the right side of the brain has an issue. Other signs of a stroke you could have is, we could look at the face. You realize that some patients can come with a dropping eyelid. If you tell someone to smile, or if you tell someone to express their facial muscles, you could realize that one of the facial muscles, especially around the eyes, is lagging, or we call it a face drop. So those are some of the signs that can tell you that my sister, my brother, or my spouse probably could be having a stroke. The listener and the viewer out there, it is important for you to know what are those things that can predispose me to a stroke, or what are those things that can lead me to have a stroke. And us at Doctors Case Medicals, we have realized that majority of these things are non-communicable. If we say non-communicable, we mean that you will not get it from someone, okay? That by the mere fact that someone has touched you or someone has coughed, that it will predispose you to a stroke. No. So we have found out that majority of these causes are non-communicable and we can avoid them. One of them is a high blood pressure. It is culture that each and every time you step into Doctors Case Medicals, we are very eager to know what is your blood pressure reading. We want to know, because it is one of the risk factors of of stroke. So if you have a high blood pressure, you have been told that your pressure is high, you're still in denial because people fear to take drugs, and you have your blood pressure very high for a very long period of time, that can be a very good risk factor of stroke, especially the hemorrhagic strokes. You could easily bleed into your brain and end up with a stroke. So we have it as a culture in doctor's case. Immediately you arrive, we have blood pressure measurement free of charge. Then other risk factors or that can lead you to have a stroke is diabetes. We have realized that the cases of diabetes have increased, and these are avoidable things. Again, diabetes also has got its risk factors. So if you can deal with things that can cause you diabetes, we can deal with things that can prevent you from having the stroke. For example, very many of you are very inactive. From office to work in a car, from work, you go and pick your child in a car. When you reach home, you're on a laptop. So there is a lot of inactivity. That is very dangerous. So inactivity can predispose you to diabetes, and diabetes in the end can predispose you to a stroke. So the person out there should know. Then there is what we call obesity. People think having a lot of weight, putting a lot of weight, they think you have money, you have arrived. Peter has money nowadays, you can see he's fat. So it is important for you to know, the more you put on weight, the more you have a lot of weight, it is predisposing you to having strokes. Reason is you are going to have a lot of fat in your blood, you're going to have diabetes setting in, and that can give you a stroke. Then other things we realize is reckless or poor diet, okay? And again, majority of the people think eating meat every day, eating chips every day, having ice cream, that is the fancy life, okay? But these foods can give you weight still. Again, these foods can predispose you to getting high pressure, and at the same time they can give you diabetes. So that can give you, predispose you to having a stroke. So the range of things that can give you a stroke or can predispose you to having a stroke are too many, okay? But we are here to give you a tip of an iceberg, okay? That such and such a thing can predispose you. But again, out there, I don't want people to get me wrongly. It is not that every fat person, every person that has weight will have a stroke. We are simply saying, from the people we see, at least we have realized that the people that have a lot of weight, that are obese, they are at high risk of doing what? Of getting a stroke. Of course, there are some other things we could avoid, especially smoking. Smoking has a lot of damage on your blood vessels, and that can predispose you to a stroke, in accordance to a lot of alcohol. Okay, I'm not saying people don't take your alcohol. Social drinking is okay. You can have a glass of wine, you can attend a function and have a bottle, but again, irresponsible, excessive drinking. I've seen people that compete to finishing a crate. Okay, two people sit aside and compete to have a crate. So if you have such kind of behavior, alcohol is very poor, is very bad for your body, and it could predispose you to developing strokes. So those are some of the things we can avoid that can give you, or that can put you in a position of having a stroke. And it is important when you reach here at Doctor's Case Medicals, because we are very keen. We want to give a holistic health care to our people. Don't get annoyed when we ask you, do you take some alcohol? Do you smoke? What kind of job do you do? We are simply trying to look out for the risk factors that could put you in a position of you developing a stroke in the next 1 year or the next 2 years, okay? The other thing I want to educate us is how, when you reach hospital, how do we receive you and handle you, especially at Doctor's Case Medicals. It is important that the listener out there we carry out a wide range of services, ranging from finding out how much fat you have in your blood. We want to know your blood glucose. We do blood pressure measurements. We want to know. We do a lot of imaging. We shall scan and see probably this person is at risk. So when you get to hospital, when you encounter a health professional, you have had an encounter with a doctor, he knows what to order. For example, if a patient has a stroke and I realize that this patient has been having high blood pressure or diabetic for the past 6 years, I would do you a disservice if I'm not trying to look out for how well your body has been controlling glucose, okay? Then 2, I want to know how much fat you have. The listeners out there, fat is not bad entirely. In the body, we have got what we call the good fat and the bad fat. So we are always interested in how much bad fat you have, okay? So we always have those tests. We want to know how much bad fat we have in our body so that we can give you drugs to reduce that fat and take away those stroke symptoms. So we can run those tests. Again, it is important, the listeners, to know out there that there are other things that we do, because some patients can have symptoms that can mimic, or they can present as if you have a stroke. Okay, so don't see us failing to do your electrolytes. Electrolytes, usually we mean every person has the salts that run your systems in your body. So when you come and you have a stroke, we want to know how are those salts in your blood. So what I'm trying to tell the listener and the viewer out there, that when you arrive and we tell you that these are signs of stroke, or as I've educated you, you can clearly tell that this is a stroke, we shall run a series of what? Of tests. Then lastly, what I want to educate about us is be vigilant, watch your lifestyles, and it is a habit that you should take. See a health professional, not just a mere health professional, but a well-trained, experienced health professional, just as we have here at Doctor's Case Medicals. Thank you for listening.